We'll get this done together. Please. Yeah. I get yelled at by the guys.
All right. Microphone on. Can you hear me in the back? All right. Well, love to welcome our distinguished visitor, Representative Nunn, here today to celebrate the groundbreaking on our new dialysis center. I think we'll get the proceedings kicked off right away. We're going to have a little round table here to begin with, just visit a little bit about various topics, and then along towards 1 o'clock, we'll kind of wrap this portion up. We'll go on a little tour around the facility with Congressman Nunn, and then we'll come back this way and pick up anyone that would like to follow outside to the actual groundbreaking ceremony. Most all the talking will be done in here today since it's pretty hot, but out there we'll just have some photo opportunities for those folks who would like to celebrate the turning of the dirt. So with that, I'd invite all of our guests to sing.
Thanks, sir.
So, Congressman, before we get started, I want to say thank you, and I want to be specific about it because the specifics are what really make it real here. So, everyone's aware of the big beautiful bill, the budget piece that went through a while back, and that had some specific funds for it to come out to support rural health care. And in specific, Representative Nunn was key in helping Iowa secure $209 million. But what's important, I think, today is that those funds didn't stop in Des Moines. The state did a good job coming up with a method for those dollars to be moved out to the providers and the institutions that can help. And it was through the Healthy Hometown grants. And 3 of those grants landed here in Wayne County. The first was $120,000 for physician recruitment. The second was $5 million to stand up radiation oncology. And then $31.9 million for the Cancer Hub and Spoke Network, which we're leading as the hub and have partnerships with Decatur, Clark, and Lucas County to provide what will someday be a cancer center here in Wayne County. This is what federal appropriations looks like when it actually reaches the far end of the district. And that's really only one of 2 ways that you've helped us here. So today, the $2,011,000 that you carried through the appropriations bill for us, I think almost 2 years ago now, is really why we're putting a shovel in the ground today on the new dialysis center. So we thank you for that, and I'd like to pass the microphone over to Darrell Cook, our board chair.
Mr. Chairman.
I think I'm gonna try and do this without. Can you all hear me?
No.
Oh, yeah. Appreciate you, Cindy.
Nothing like a hometown crowd to keep you
Yeah,
on, right?
They're all looking. I think they're not looking bad at you. They're looking bad at me. Congressman, I flew in the back of E2C Hawkeye off of various aircraft carriers. I know that you've had an aviation background, so I was just trying to make sure we're
I
connected.
appreciate anything. Gotta have a good co-pilot on this operation.
I've been on the board in various capacities for 20 years and current chair, but there's other chairs out here on the floor as well. So, just my turn. This board's never lacked vision. What we've lacked is capital to put that vision together with community needs. And what you've done is provide that much needed capital. And I can't even tell you enough how much appreciated. These folks over here are part of that capital and then building it. That's wonderful too, but
Yeah.
appreciate it.
Hey. Yeah, well, 10
Well,
altogether.
10,
That's right.
And conservatively, people make such a difference to those 11 that are driving 75 miles one way 3 times a week, and to countless people that come to this. Thank you for everything.
Thank you. Good job.
Hi, Senator. My name is Amy Wood. I am the longest, not really the oldest, but
I was gonna say, you look like the youngest here.
I am the longest active medical provider here in our hospital. I've been here for 25 years. When I was an undergraduate and then went to PA school, rural medicine was very important to me. The program that I was involved in actually had special funding to make sure that PA students that they produced were going to go to the rural communities to serve. So my question is to you, what do we need to do in this facility, in our hospital, that we can ensure that we can train rural providers at that stage? Because if we can train them here, they can see it, they can use it. And we've had lots of opportunities to train students, but what can we do so we can help people when they go into some of
You want me to jump in on the Q&A first, and then I know everybody's got a couple of questions here. All right, well, hey, guys, first of all, I just want to say thank you very much for Wayne County, for coming out here, spending a little bit of time, not only educating me, but I think having a really good back and forth on what we need to be able to do to keep rural Iowa successful, most importantly, to keep our hometown community successful. Look, I'm a 6th generation Iowa kid, went off, joined the military, we saw this firsthand. We are all a family, and we are all trying to take care of each other. This is not a Republican or a Democrat issue. This is like, how do we take care of the next generation, and how do we take care of the families who are already here? So I want to begin by saying thank you to each of you. Whether you're in scrubs today, or whether you're in a uniform today, including our young deputies, or whether you're a patient here, here's an opportunity for us to get around real solutions that make an impact. So let's just walk through this, and then Amy, I'm going to jump directly into your question here on how do we keep and retain a workforce. First and foremost, I think it's important that we talk about what we were able to bring back to Iowa, because this is a huge win. Look, we are not flyover country. We are the heart of the heartland. Being able to keep our rural hospitals open, but not only open, serving above and beyond is what's going to keep rural America successful. So this year alone, we were able to pass, just about a year ago, a bill that made sure that we had $50 billion invested specifically in rural healthcare plans. Iowa was the first state to be able to stand up and get $209 million of that directly invested here. And no longer are we going through CMS. We are working with our state partners who know it far better than the federal government or any bureaucrat in Washington, D.C., how to deploy these funds. That means we're working with Iowa's HHS. It's a huge opportunity for the hospitals, and to our point, Amy, here, it's a huge opportunity for the workforce. Let me break that down the next level too, because I think this is really important for what we're here for today. Of that $209 million, we're going to put $120,000 towards physician recruitment so that we can have more doctors right in rural communities like this. And being able to put this right here in Wayne means a new doctor being able to come on board. That's part of our workforce front end. We're also looking at a $5 million stand-up of a radiation oncology hub. This is huge. It means that now not only does Wayne County get to have this resource, but the 4 surrounding counties also get to plug into this in a real hub and spoke model. Additionally, we're putting $32 million towards our central hub, and this is expanding on the preventative side for what we can do for cancer. We all know this. Iowa has a long history with both cancer, including what impacted my mother, and I'm sure everyone in this room knows a family member, a friend, or a community member who's been impacted by cancer. We in Iowa have to do our job to not only get ahead of this, be able to provide preventative solutions. What this $32 million goes towards is making sure that we work with Medicare to be able to expand. This is one of the areas I've been very proud in Washington, D.C., leaving no patient behind, expanding Medicare programs that work to serve Iowans, the cancer prevention side, a huge step forward. While at the same time, with Medicaid, we're making sure that it gets to a single mom with kiddos, that it's getting to seniors who need it, that it's getting to individuals with disabilities, but at the same time we're holding Medicaid accountable for areas where there have been serious fraud, waste, and abuse cases. Everything from double bookings in some states to overpayments that never get reclaimed by the taxpayer, and tragically, a number of individuals who are in the country illegally getting that money before the people who really need it in our communities do. By holding Medicaid accountable, we not only make sure it's there for the people who need it, the providers, the staff, but most importantly for the patients who depend on it. And by expanding Medicare, we're getting ahead of our ability to make sure we're providing preventative solutions not only for dialysis, but for things we're trying to do in cancer prevention. And one of the areas here, in addition to Decatur, Clark, and Lucas that will plug into this, Wayne gets to be the hub mom. And this is really exciting, because not only do we get to provide it here, it means we now have a center of gravity to start bringing in some of the best and brightest. I want to thank our private partners who have been involved not only in this project with the $2 million for the dialysis center. I want to talk to maybe some young folks who are in the audience today. In the next 9 years, Iowa alone is going to need 85,000 new nurses. And that's partly because we've got some great nurses who are ready to retire, but it's also a challenge that we need to have to be able to retain workforce right here in the state. I am thrilled, and we're going to get into this and talk about what we do to help teach nurses. We've got to also talk about what we do to keep our best nurses here. Kevin, you've been doing this for a long time. You know it better, and you're going to tell us some ground truth on this. We've led on 2 bills that I think are really important for this. The first is our Train More Nurses Act. Right now, there's 40,000 young kids in America that want to be nurses, and they jump into it tomorrow if they could. The challenge is, for a lot of them, including right here in Iowa, we're talking about a 2-3 year wait period just to be able to get into your first class. What do you think that does to a young kid? They're going to say, I'm going to find something else to do, candidly, and once they leave, it's very hard to pull them back into it. Equally important, if it is hard for you to get trained here, you might end up leaving Iowa. And we know this is true too. It's a privilege to serve, and we've all had the opportunity to see the world around us. But I wouldn't trade a day of it for having a day back here in Iowa. If we don't afford our young folks the opportunity, or our mid-career folks the opportunity to stay local, they're going to go off, and candidly, not all of them are going to come back. So how do we make sure we invest in making, once you graduate from a nursing program, that you have the opportunity to be successful in a rural hospital like what we're doing here in Wayne? That's exactly what we're doing with the loan forgiveness, as well as incentive bonuses for folks who want to stay here and work 5 years. The same is true for our Train More Physicians Act, getting more physicians, particularly in OBGYN and general practitioners, out to our communities. The reality is this: if you train here, you're more likely to stay here. That's because you love the community, that's because you see the value of what a rural hospital provides, and maybe if you're lucky and you're a young nurse or physician, you meet somebody in the community and they might keep you here too, which ain't bad. We can start making some more babies in this community, and that's not a bad thing either. The other aspect of this is we really want to make sure that we are investing in a long-term future. And so, as Daryl, my wingman for this event, has highlighted, this is not a one-time spending. This is a 5-year commitment of what we're able to do for infrastructure at our rural hospitals. That gives rural hospitals not only breathing room, it affords guys to be able to make an investment in the workforce that's necessary to be able to fill this going forward. So let us be your partner in this. You've already been good leaders in doing this. Let's make sure that we provide the hard infrastructure to build things like the dialysis center, cancer prevention and screening, invest in long-term patient care, so that we can allow you to make the investment on how we pay for quality healthcare professionals in the field right now. I would say that's a long-term strategy, and that builds us up for not only the next 5 years, puts us on a good path for the years ahead of that. All right. Amy, did that generally answer your question? Copy. Okay, we'll turn it over to the round table then. Yeah.
I'll pass it over to Kevin, but some of that question's been addressed. But
I was going to say, you already addressed the question. I was going to ask, and I certainly appreciate that.
Kevin, tell us maybe a little bit from your perspective as the CNO, how it is recruiting nurses, what you're hearing from your nurses, stuff that I should be taking back to.
Well,
And some of the folks in the back are probably going to want you to use the mic. I know. I don't like it either, but it's for the ease of access over the refrigerator there.
recruitment is a struggle, but it's a struggle for, I think, all rural hospitals and probably metro hospitals as well. But, you know, we've had to be creative in some of our ventures. We take on nursing students as CNAs, and we bring them on board, let them get a feel for our facility here, and we're able to retain those nurses after they complete their school. So we've been pretty fortunate that way. But we're still recruiting now, so.
Kevin, Kevin, real quick, I'll just say, from my family experience, all the ladies in my life, except for my daughters right now, I got 5 kiddos, but my mother, my grandmother, they're all become nurses or nuns, and I'm happy to say more have become nurses. I'm the only nun left in the family, so but I will highlight this. There's some areas where we can do to help our current workforce of nursing professionals, whether you're a CNA, as my wife started off as, or whether you are an RN or a BSN or a master's program. First and foremost, and I'll say this, I'm a Republican, but I sat down and I met with the Teamsters, who are largely a union-driven aspect, but we've got some nursing concerns going on in Iowa right now. First and foremost, no other career field suffers the abuse, particularly in metropolitan hospitals and rural hospitals, as our frontline nursing staff does. And I say that with great respect to our deputies who are out there on the line every day, but nurses face threats that no one in any career field should ever tolerate. Being able to protect our nursing staff and giving them some rights, kind of a nurse's bill of rights on what they should find both acceptable and have recourse to protect themselves from, is one of our top priorities. I just had the Secretary of Labor out here, and we identified DOL's got to get ahead of this and empower our nurses to be successful. The second one is patient care. Making sure that nurses have the time on the floor, whether it's in the dialysis center, whether it's in the ER, whether it's in long-term care, to afford our nurses the opportunity to take best care of patient practice. You've been a leader in this, Kevin, since your entire career. You've seen how the career field has changed. We've got to reinvest in our nurses, and that comes to our third point that we've highlighted here with Health and Human Services Secretary, who we'll have out here on Monday. Making sure that you have not only the wages you deserve, but a work schedule that accommodates a complex life. I know our nurses are working 24-hour shifts. I know that there's a lot of nurses who are working third shift. We've all worked third shift. It's hard. It's hard to do it for your entire career. And there are some people out there who love working third shift. But a lot of folks need that rotation, and they need to be compensated at a level that keeps them engaged. The worst thing we can do is to ask our nurses, incentivize our nurses to come here to work hard and then have a washout rate of 20% time and time again, because we are burning them out in their first year at such a rate where they just say, I can't keep this up. So I want somebody to be able to come into a hospital like Wayne here, have a great experience, work hard, but still want to show up after 20 months and say, this is where I'm going to set up my shop. So I appreciate what you're doing, and for your nursing staff here, thank you very much. It's a lot.
I don't want to belabor the piece about the number of dollars, but I think something too in the healthcare climate in Iowa has shifted some. I think that the way the state has engaged with these dollars has been very refreshing. Typically from a provider or a hospital aspect, your interactions with the state are largely regulatory. And so that comes with a sense of, well, we'll call it dread and fear. But but it's their role to play, and we all understand it, and we all work together with the state for that. What these grant opportunities have provided for is very, very motivated staff at HHS who is looking to work alongside of us in much of a more partnership approach than what we've ever experienced before. I think the state's done a great job also identifying that some of the barriers to healthcare do happen to fall on the lines of the systemness that we have in Iowa. And so, for instance, the Cancer Hub and Spoke grant that they put out, the first round of those grants, indicated that of 4 participants, no more than 2 could be from the same system. And I can tell you from my own personal experience, while my peers and neighbors to the west and the north of me, I've worked with for years, and we partnered on certain things. We're partnering in a new way. We all met for the first time on this project around the table together and said, really, kind of what a wonderful thing the state did, getting us around the table and doing it in such a way that none of us really could fear any reprisal from the system feel that we've all been accustomed to in Iowa. Now, our organization made the decision a couple of years ago to become independent. I feel like it was a very strong move for us, and it has come out, over time as being, I believe, the right decision. But we're coupled in this opportunity with two other hospitals from one system and the third hospital from the other system. So the state's done a good job breaking down some of those barriers and helping us to work together. And the winner in that really is our populations. And and the fact that we can work in a geographically contiguous area here and share resources back and forth more efficiently than we've ever been able to create more capacity for care. And I just think it's been a wonderful thing. But one thing I think we all feel sometimes in rural Iowa is the pull and kind of a sucking noise to the metro areas of the resources that exist. And you know, I heard it said once that when food gets slim, the table manners change.
Yeah.
And so I think that's true for any of the resources in the governmental aspect or healthcare or whatever. But it really has been a huge boon for Wayne County and again, going back to the comment, of the $209 million that came into the state, Wayne County is receiving $37 million of that portion. And
Good
so
job. I mean,
we are. Compliments to the powers that be for creating a situation where we can competitively go after some of those funds. But this will change our region in terms of healthcare. I think it'll do great things for our people, and we're very, very appreciative for all the help in shoring up these resources out.
Well, Darren, I appreciate that. I want to give credit where credit is due, and it's on this side of the table. All of you folks out there, first and foremost, whether you knew it or not, your tax dollars go off to DC. One of the questions is, what do we do with those tax dollars? A huge aspect of this is all of you have been great advocates for what that investment means back in our communities. So first and foremost, we were able to get $17 million appropriated specifically for projects back here in Iowa. And I'm happy to say those go to hard infrastructure dollars. It's paving a road in diagonal Iowa. It's putting in new water infrastructure. It's being able to invest in what we've been able to do here with the dialysis center in Wayne County. I know this much is true. For every tax dollar the government asks of you that we can bring back to a community like Wayne County here, that's a 400% return on economic growth. It means a community like everybody here in town has the opportunity to be successful, not just what we saw handily a few years ago where it went off and we largely never saw it back. Or worse, to your point, it was a federal program that largely deployed it to mass population zones. And that's nothing against Des Moines, the metro, but it forgets about our rural communities, which have a smaller population, but they have the same life and death need if we don't do this correctly. The other aspect I will say is we were able to bring just about $200 million in grants. That's grants that go to our law enforcement and safer grants. That's grants that go to our communities for buying new hardware and equipment to keep our radios going so our ambulance calls can go out. And we also were able to do, this past year, I think, what the American Cancer Society has said, the best Congress in history when it comes to addressing the needs of cancer. And this came from listening sessions just like this. You know, Mike Sexton, our USDA lead, has been a leader on this both at the State House when we work together. We know we've got a challenge here in Iowa. We've got to get ahead of the ball on being able to address, you know, new cancers that are arising. Iowa is the second most impacted by this. So how do we do that? One, we got most recently mitigation for radon, something that I think is absolutely needed in our communities. We were also able to bring $128 million to cancer research, the highest ask that's ever been awarded to the NIH, directly impacting what we can do for patient care right here in Wayne County. So I agree with you, federal dollars invested are important. How we deploy those federal dollars, I would say equal or sometimes even more important, because we can write big checks in Washington, but if it just stays in Washington and doesn't get out to the communities that need it, it's not even worth it. So thank you guys for not only using this money, deploying it effectively, and I will say candidly, working with our local communities here who are able to support that too, to show there's real investment, there's skin in the game, not just from the taxpayer, but from all of us here.
I would say too that those dollars, when they're appropriated in DC, have a mechanism to get to us. And so I'd love to recognize Mike Sexton with USDA and all of his crew that are here that have assisted us in navigating the procurement of those dollars and how we apply them to this program. So Mike, please say a word.
Yep. Well, thank you, and thank you for inviting us here today. It's a real pleasure to be here. I want to recognize, I am the state director. It's a presidential appointed position, as well as my deputy, Henry Kemmerer, is an appointment. And then Jessica Bass Jessica actually handled this application, so she worked with the hospital, did all the hard work, but I get to be up here at the table, so thank you, Jessica, for doing that. And so folks, it's in our name, rural development, USDA Rural Development. We invest in rural communities. We actually, I describe it as being the funding mechanism for the White House administration and for Congress. And so they appropriate these monies, and then they go through us to make sure that we get them distributed across rural America, in our case, rural Iowa. And so I want to thank the administration for taking healthcare in rural America very serious. They don't want those of us that live, work, and love being in rural Iowa, they don't want our healthcare needs to be less than our city neighbors. And so that's why what we're doing here today is so important. And I want to thank Congressman Nunn. Congressman Nunn has been a leader in making sure that these funds go to rural Iowa. And that is, we talked about that, and Henry and I go to ribbon cuttings and groundbreakings all over Iowa. And one of the things we hear is in the recruitment process for nurses and doctors, if you can have shiny new toys, it makes it a lot easier to get new young doctors and surgeons and people to come to rural Iowa. So I want to thank Congressman Nunn for being a leader and making sure that these funds don't all go to the big cities, that they come to rural Iowa. So once again, thank you for having us here, and good luck, and I look forward to seeing what the future brings for Wayne County.
Thank you for that. Sure appreciate those comments. Certainly want to acknowledge too our partners on this project. Nicole Jacobson is here representing People's Bank. They've been wonderful to help us with the Todd Weir is here representing Shive Hatterley. He's our lead architect. Has been for many years on many projects. And Ken McCormick's at the table. He's co-owner of Murray Company, and there are construction folks, our construction managers at risk that are wrangling all the trades and bringing everything in on time and under budget, right?
No.
With that, I don't know if any other questions from the panel or the audience.
I've got one. So I got into the design profession and particularly healthcare almost 40 years ago, and worked with a lot of rural hospitals over that time. And, you know, things like you're doing in Congress right now to appropriate the money for these kinds of projects is a real lifeline. You know, over the years, we've seen a lot of hospitals close in the past because they just couldn't make it financially. And, you know, something has changed. Business has gotten better for us because there's some funding that's being appropriated to these rural hospitals, and that's welcome relief. One thing I was wondering if you could address, just like schools, security at schools. The biggest issue that hospitals are facing right now is security. We're seeing more and more where we have to design bulletproof desks and emergency rooms and that kind of stuff. So could you let us know what you guys are doing at your level to address that?
Yeah, great call. Thank you. Well, Todd, first of all, thank you for building by design, and thank you for continuing to build in rural Iowa. Look, here's the reality. We just last month passed the rural housing bill. It was our bill, and this makes sure that there's the opportunity to build. USDA has been a huge partner on this. The reality is, I can build a house in Waukee tomorrow if somebody wants it. It is much harder to come to court and say, I'd like to build a house by design, let alone have a neighborhood, let alone have an entire area where you got the cul-de-sac or the waterway. We gotta be able to work on this together. Guys like you, guys like Ken, still building in rural America matters. So thank you very much. We can invest on two sides on that. One, the workforce, with which we're doing at the community colleges, and two, making sure that we have the capital for you to be able to construct. Specifically to the preventative side and what we should be doing on Congress. Now, I'm not the state, I'm not running the schools, but what I will offer is we can be net additive on a couple of things. First and foremost, we have really paired up not only with our rural hospitals, but with our rural healthcare clinics. A lot of this money is going to wraparound services. I just came from Wapello where we did this in Ottumwa, a rural healthcare clinic that when you go in, not only provides for your annual checkup, they talk to you about mental health. They give you dental assistance. They give you nutritional assistance. Caring about the person holistically, I think it's something that all of our docs want to be able to do. And by pairing them up in one clinic where they can do this, we're really making sure we don't have a cost on the back end of having to have these folks show up in urgent care or worse in the ER when they've already become septic or seriously sick or have a mental health crisis that ends up, calling Keith over, calling the sheriff to town and saying, hey, we now have to deal with this. How do we proactively get in front of this? So I would say that's step one on the federal dollars. Let's have a wraparound service for these folks. Let's help our local law enforcement and our clinics. The other side I would say is, and you know this, we had a tragic shooting at Perry High School. There you had a heroic principal who stood in front of a shooter and saved literally hundreds of kids. But while doing it, lost his own life. Now there's a number of things we can do on the preventative side. In fact, it's one of the reasons that we passed, SAVE legislation, which takes 1 penny of every dollar in Iowa and invests directly in school infrastructure. And I think that's huge. It means we're building better schools, we're building safer places. But we also have to be proactive in what we can do, and this is one of the reasons I'm heading up the Artificial Intelligence Task Force to say, what can we do there to better identify these threats before they end up in our classrooms? Not only to protect the kids and the teachers, but to prevent this from happening in our communities. I worked recently with a group out of Texas. They're coming here to Iowa. They're going to showcase drones that, like a smoke alarm or a sprinkler system, when they detect that there's somebody hostile in the area, the drone takes off out of the wall and gets between the shooter and the child, the weapon holder and the victim. And while we shouldn't ever be in this situation where we have active shooters in our schools, we know that this is not something that's disappearing. So how can we use advanced technology to help us? The same thing we're deploying on the military battlefield to protect our sailors, our airmen, our soldiers. We're now looking at deploying in classrooms to be able to deter a shooter. And effectively what it does is it gets between the shooter and the victim, blasts bright lights in the eyes. If that doesn't stop, it has a pepper suppressant that gets in the face. If that doesn't stop, it launches itself into the soft points of the body to allow folks to be able to get out of that area and deter the shooter at the same time. We're not going to be able to stop things like gun violence without incorporating some really smart technologies to help mitigate it. The architectural design of this, and you can go up to Iowa State and see how kids are doing this right now in our engineering schools, have some really innovative solutions on how to do this. But like you, we have to have the funding source, which we passed. We have to have a community that prioritizes it, which is what you're building, and we have to have the resources available to deploy, I think, really cutting-edge technologies, both on the preventative side for mental health, but also on the emergency side for how do we respond. I would offer that's a holistic approach that can get after helping mitigate this, because like you, none of us want to see another Perry. I'm being told we have time for one more question. I'll open up to the staff, the community here too. If you've got questions, raise your hand and we'll shout. But I do want to say, particularly the nursing staff, I know every minute you're spending with me is a minute you're not spending with a patient, so I will get you back to getting the real work done here too.
I have a question.
Yes, ma'am.
We're just residents here in the area. My husband is disabled. He has a lot of health problems. We see probably 9 or 10 specialists. A couple of them we see in the specialty clinic here, but mostly we have to run all over Des Moines a couple times a week to see all his doctors, and it is exhausting.
Yeah.
So I'm just wondering if there's any work happening to try to bring more doctors to specialty, or different kinds of doctors.
That's a great question. Know this, you're not alone. Part of the challenge is obviously in a rural state, it is harder to be able to get specialists in every single community, but we should at least be able to get those resources to every single community. We just passed my legislation on telehealth medicine. We've seen it happen for the last 2 years and it's been very effective post-COVID. I teamed up actually with a Democrat on this. We were able to get into this year's Farm Bill, and it provides for permanency in telehealth medication. Now that's not going to solve every case, but it solves a lot of issues, particularly on the counseling side. You can't do it for dialysis. You got to have a dialysis center here. But if you need a consultation with a doctor, making a drive to Iowa City or Des Moines once, twice a week for something that could be done online or in communication, particularly if somebody is reaching mental health issues, if they need a resupply of their prescription or aid, we should be able to do this with a physician assistant and an overseeing specialist back in one of those hub and spoke models. In the same way we're doing for cancer here, we've been able to do, and I want to highlight this, $5 million for radiation oncology out of that $32 million hub. Make sure that folks aren't driving that 120 round trip ticket every time they need to go through it. We've got to be able to use our regional hospitals as, opportunities for folks to come here. And sometimes that means, with $120,000 we're getting for physician recruitment, it might mean we send somebody from the VA hospital in Des Moines, or Unity Point, or Trinity, or one of the others, to come down here and have a Monday or Thursday service where they're providing based on the needs of the community. We got to be able to have the infrastructure to make that happen. I think there's a real pathway here, but I will offer this. The first $209 million is exclusively intended to be able to help cases just like yours. Invest in rural and regional healthcare centers, provide more preventative assistance at wraparound clinics, and ensure that we have long-term telehealth medicine so this doesn't expire at the end of the year. We've been able to fund it into perpetuity because it's been so successful. Let's make it a reality here for Iowa. And best to you and your family. I know that's hard. All right, for anybody who'd like to join us for the dialysis center, we're going to do it right out here. I know it's hot. I'll stick around here for just a little bit while we get things teed up and answer any questions. Let me in with this. Wayne County, seriously, you have a lot to be proud of. Not only do you have an incredible team up here, you guys have become the model that we want to use for Iowa at how we can have a partnership with our other counties on regional health. More importantly, I love to say this, Iowa sets the gold standard on this. If we get it done right here, this is a model that we can deploy to every other state who also has a rural community. This doesn't just have to be a conversation about what we do in Chicago or New York or LA. We can start talking about what we do in Lamoni and Red Oak and Atlantic to be successful. Other states want to follow this model. You guys get to be first, but that means you also get to be best in show when we're all done with this. So thank you very much, guys. Appreciate it.